Hi, everyone. Hopefully everyone can hear me okay. And thank you all for joining. So my name is Marina. I am the webinar coordinator for Evidence Synthesis Ireland, and we're delighted to welcome you all to this exciting webinar on systematic reviews in preclinical studies. So just a brief introduction for those of you who may not know much about us. So ESI, Evidence Synthesis Ireland, includes Cochrane Ireland and is an all-Ireland initiative funded by the Health Research Board and the Research and Development Division of Public Health Agency in Northern Ireland. Our aim is to build evidence synthesis, knowledge, awareness and capacity on the island of Ireland, and we have a number of key activities for achieving that aim, and one of them is a monthly webinar on an evidence synthesis topic. So we have two presenters for today, Professor Marel Riskes-Hoitinga, Head of SICRL in the Netherlands, and Miss Nadia Suleiman, Imperial College London. So both Nadia and Marel are on the line with us today, and we're absolutely delighted to have, and I'll briefly introduce them before I hand over. So Marel graduated as a veterinarian in 1986 and has been committed to improving quality and relevance of preclinical science and animal welfare. She's now Professor of Evidence-Based Lab Animal Science at the Radboud University Medical Center in the Netherlands and an honorary professor at the Department of Clinical Medicine in Aarhus University in Denmark. She founded the Systematic Review Center for Laboratory Experimentation in 2012, focusing on education, coaching, and research in the field of preclinical systematic reviews. From 2005 to 2017, she was the head of the Central Animal Facility and professor in Lab Animal Science in Radboud. From 1997 to 2005, she was professor in Lab Animal Science and Comparative Medicine and the head of Biomedical Lab at the Faculty of Health Sciences in the University of Southern Denmark. She organized the first international conference on systematic reviews of animal studies in 2012 and organized a workshop at the Cochrane Colloquium in Quebec in 2013. So on to Nadia. Nadia has a BSc in pharmacology and an MSc in drug discovery and a Master's of Research in cellular and molecular biosciences. She's in the final year of her PhD at Imperial College London, and she looks at developing automation technologies to improve the feasibility, efficiency, and accuracy of preclinical systematic reviews. So a little bit about the topic. We'll be talking about how preclinical studies aim to improve information on the safety and efficacy of new treatments. Systematic reviews support the actual implementation of replacement, reduction, and refinement, the 3 Rs, and lead to a more evidence-based choice of animal and alternative models and create better transparency on quality and translation of preclinical studies. So this webinar will explain the methodology and give examples. So in the clinic, systematic reviews became routine since '92, when the Cochrane collaboration was founded. The first preclinical systematic review was published in 2001, and since that's been on the rise ever since. In the Netherlands, a recent impact study among researchers having performed preclinical systematic reviews demonstrated widespread positive effects. So Nadia's PhD looks at improving the feasibility and includes crowdscience for collecting data. She will signpost technologies to improve the feasibility, including machine learning, and she'll highlight a requirement for close management and inherent risks. So before we start, just to say we have turned off video to ensure there's a good sound quality for all attendees. And we will have time for questions at the end, so we do encourage you to type your question in the Q&A box as we go along. And hopefully you should have the option to upvote these questions as well. And just to say that we are co-branding this webinar with Shure, and we are delighted to do so. So we will make a recording of this presentation available on our website, and we do also encourage you to sign up to our newsletter. So a link will be in the chat box below. So that's enough for me for now. I will hand over to Marel and Nadia, the experts, and thank you both so much again for joining.
Thank you very much for this nice introduction. I hope you can all hear me well and see the slides. My name is Merel Riskes, and I'm going to present the value of preclinical systematic reviews. I have a professorship in evidence-based laboratory animal science since 2017. It used to be laboratory animal science, but because of our focus on systematic reviews, this has changed, which also led to a new inaugural lecture in 2019. And if you're interested, you can see the full recording with English subtitles on YouTube. We are based in Nijmegen in the Netherlands at the Radboud University Medical Center and the Systematic Review Center for Laboratory Animal Experimentation was founded in 2012. I've put the word animal in between brackets as we are also beginning to focus a lot more on replacement of animal studies. So a bit about me. Who am I? Why did I start working in the field of laboratory animal science? My full CV, there is a personal website. I won't go into all the details, but I would like to emphasize why I started working in this field. In my graduation year at vet school, I did a literature review on atherosclerosis in the rat, and that's when my motivation started to work in this field, as it became clear to me there was a huge room for improvement in using animals in research. So this led to my mission of achieving better science and better welfare and resulting in better translation to avoid unnecessary animal studies. So a little bit about systematic reviews. Probably you're all aware of what they are. They are simply saying or stating in a simple way to get the knowledge that is out there in a complete and objective and critical manner. So when you do a systematic review, you phrase the research question as the first step. You search for all evidence, step 2. Step 3, select the relevant studies. The step 4 is to extract the study characteristics and then assess the study quality. And if possible, you do a data analysis or meta-analysis of all the studies together. Our ministry has given us a subsidy for preparing a free e-learning to make this education available to all researchers. And you can do it yourself if you like. Here is the website address and the registration code. And it takes about 1 hour. And after successfully finishing this e-learning, you will also get a digital certificate. By now, more than 4,000 participants from 65 countries have taken this e-learning already. Systematic reviews are relatively new within the preclinical field. Within the medical field and for clinical studies, the Cochrane collaboration has already been in existence since 1993. And so systematic reviews for human studies are common ground and are called evidence-based medicine. In the Cochrane logo, you see the first meta-analysis, which showed that the use of corticosteroid therapy to mothers giving birth to preterm infants led to a significantly reduced death of these preterm infants. And I've been told this was the first time that evidence was presented that a clinical therapy works. The Cochrane was modernized a couple of years ago, which resulted in a more modern logo. So I will show you benefits of preclinical systematic reviews that we have experienced within Circle since 2012. I will go through each of these items in the next slide. So more evidence-based choice of the model, phrasing research questions precisely, creating transparency on quality of reporting and translation, identifying the relevant research questions, so generating hypotheses, implementing the 3 R's, and improving protection of humans in clinical studies. So first, the model choice. Rob de Vries did a systematic review on the use of animal models in the field of tissue engineering therapy for cartilage degeneration in humans. It became clear that many people choose models on the basis of tradition. And this article pleads for a change to make your choice of the model system on the basis of evidence. And a good way to start doing this is to ask yourself, what is the human disease? The conclusion was that many rodents are used, but this is not a good model for studying tissue engineering for cartilage degeneration, as the lesion in the rodents will always be osteochondral, so getting into the bone, whereas the lesion in humans are usually partial thickness lesions, so only in the cartilage, which leads to a slow recovery process as you do not get blood vessel ingrowth. Systematic reviews also ask you to phrase your research question precisely. And in this case, I would like to show this example that you should start with the human disease and preferably ask patients what's important to them. The James Lind Alliance is a cooperation between funding organizations and patients organizations in the UK, where the top 10 is formulated of the problems that are relevant for patients. In this case, the asthma patients said they did not want new drugs, but wanted to learn physiotherapy to cope with their breathing during asthma attacks. So then a clinical trial was started with physiotherapy, which had very good results. And the beauty of this example is that animal studies could be avoided altogether. A very unfortunate benefit is that systematic reviews create transparency on the quality of reporting. Our systematic reviews at Circle of more than thousands of publications show that 50 to 80% of publications lack essential details. You see in figure A a lot of red, which means that these items have not been reported. And then figure B shows a lot of orange, which means that you cannot really estimate the risk of bias when interpreting these results because so many details have not been reported. Systematic reviews also help to create translational transparency. Here you see an example from the British Medical Journal from 2018, where a TB booster vaccine was tested in humans and appeared not to have a positive effect. Based on animal studies, this clinical trial had been started because animal studies had shown positive effects. However, a systematic review done afterwards of all animal studies together also showed that there had not been a good reason to start the clinical trial in the first place. And the British Medical Journal went through the history of this whole story and concluded that a pick and mix approach had occurred for using animal studies to obtain approval for the ethical approval for clinical studies, as well as for funding. From Circle, we were invited to write an editorial on how we can improve the conduct, reporting, and appraisal of animal research. A lot of scientists within basic science think that systematic reviews are not the way forward. However, if you have a bright new idea, it's good to see if that idea hasn't already been performed. Moreover, you can generate new hypotheses. And a researcher, Tristan Hollier from Denmark, did a systematic review in fundamental neuroscience and showed that you can do systematic reviews in fundamental neuroscience and can get a good publication out of it as well. Our surgery department did a systematic review into animal models on intestinal anastomosis. Intestinal anastomosis is necessary when there is, for example, cancer in the bowel, then a piece of the bowel is removed and then the intestine needs to be sutured together again as an anastomosis. On this topic, 1,342 studies had been found in the literature, and it was found that 88 repeated the adverse effect that chemotherapy has on intestinal wound healing. Hopefully, this systematic review will prevent that people will do more studies on this topic, as it is a well-known fact that chemotherapy has an adverse effect on wound healing. At Circle, we've made several search filters to be used in the databases in PubMed and Embase. So you can just copy and paste this in the search bar and combine it with your own search strategies to find all animal studies on the topic you're looking for. Last but not least, systematic reviews help to protect humans. Nimodipine was a drug which was tested in stroke patients on efficacy and turned out not to have a good effect. The clinical trial had been based on positive results from animal studies, and the medical doctor Janneke Horn decided to do a systematic review of the animal studies, which showed that also with all animal studies together, nimodipine had not a positive effect on stroke. This also was shown for side effects. So antithrombotics were used in stroke patients and showed severe side effects, which had not been seen in individual animal studies. Again, a retrospective systematic review of all animal studies together showed the same side effects. So again, this could have prevented the problems in humans. So I will now go to the second part of my talk on an impact study that was performed by the Dutch health funding organization ZonMW on their program of stimulating synthesis of evidence and systematic review. The question was whether the program we had been running was what the impact was on research and researchers. Julia Manon carried out this study, and you see here AVIR, the logo of the Ensuring Value in Research Funder Forum, as Julia has presented these results to the Funder Forum, and I'm using her slides now. I've become involved in the Ensuring Value in Research Funder Forum a while ago because the Funder Forum is formulating 10 guiding principles for funding, and they started off doing this for the clinic. And I thought that would be very valuable to extend this to the preclinic. And so this year we started working in a preclinical working group within the Funder Forum. The initial founders were ZonMW in the Netherlands, the NIHR in the UK, and PCORI funder in the US. And for today, Principle 2 is very relevant that research should only be funded if set in the context of one or more existing systematic reviews of what is already known or an otherwise robust demonstration of a research gap. So what was the aim of the ZonMW impact study? What impacts do conducting preclinical systematic reviews have on researchers and their research? So this relates to this funded program of the past 8 years. The ZonMW grant scheme, which was called More Knowledge with Fewer Animals in the Netherlands, contained the following elements. There was a funding program for making workshops, one-day workshops, possible. Participants received grants for these workshops to attend these workshops for free. Then people could apply after the workshop for getting funding for coaching, so they could perform a systematic review themselves with the help from my co-workers from Circle. So participants performed preclinical systematic reviews. And then we wanted to know what is the impact on research and on researchers. Julia did an inventory of all the workshops and publications. She did questionnaires and held interviews. First of all, the results of the inventory of the workshops. You see here the years and the scores that the participants of the workshops gave. And so the total average was 8.2 by the participants of the workshops. We gave in total 21 workshops with a total number of participants of more than 385. Of those workshops, 88 chose to perform a preclinical systematic review, and at the time of the impact study, 38 had been published. Then 37 are still ongoing, 7 have stopped or are at an unclear stage, some produced a product otherwise than a systematic review, and 5 never started. So again, back to the grant scheme, with the funding of workshops and coaching, and the performance of preclinical systematic reviews, what did it lead to with the impact on researchers? First of all, the conduct of systematic reviews make participants gain skills, insights, and realize some aspects of research. People mentioned they are confronted with badly conducted reported studies. They changed their opinion regarding the overall quality of animal research. They indicated they had learned new skills and understood the value of systematic reviews. They gained insights on their fields, so they learned to identify data gaps, bring new knowledge, and confirm and refute theories. And they realized impact of research on animals in general and realized their own past mistakes. So going then to the impact on research. The conduct of preclinical systematic reviews seems to impact research at 3 levels. Impact at the lab and team level, impact at the field level, and impact at the science community level. So starting at the lab team level, people mentioned how it changed the way they planned, conducted, and report experiments. Also, the knowledge transfer within the team was mentioned as an important impact. Then the impact at the field level was that it brings new insights. It inspires to new systematic reviews and primary studies, and the wish to write opinion papers and advocate for change. Then the impact at the science community level was that people thought systematic review should become a requirement for ethics applications and funders applications, and that more training and education is needed. So in broad, the conclusion is that conducting preclinical systematic reviews impact research and researchers by influencing thinking, behavior, and actions. And you can read the full report online at the website of the ZonMW funding organization. So as future directions, the participants indicated that this was a good program that was appreciated, and they advised that it should get a much broader use. So to come to the take-home messages and future considerations, systematic reviews show many benefits, impact on research. The execution of systematic reviews shows many impacts on thinking and behavior, and thus impacts researchers. And for the sake of animals and humans and science, it is necessary to conduct systematic reviews before embarking on new projects. And for example, funders can play a major role in stimulating systematic reviews by funding, education, and coaching and execution. So thank you very much for listening. You can find more information on our website. You can subscribe to free newsletters. You can also send me questions by email, of course, and I will be very happy to take questions later on. Thank you very much.
Thank you so much for that, Marel. We might hand over to Nadia for the second part of the webinar. Thank you so much.
Sorry, I'm just starting to share my screen. Give me 2 seconds.
Thanks a million, Nadia. Take your time.
I think you should be able to see my screen now.
Yeah, perfect. Thank you.
Brilliant. So hello, everyone. My name is Nadia, and as I was introduced, I'm a PhD candidate at Imperial College London. Thank you for the opportunity to speak today. My PhD is focused on improving the feasibility of preclinical systematic reviews while answering questions of neurobiological importance. It's quite daunting going after Meryl because she's done so much in this field, and I have to say how amazing the Circle resources are. So I do recommend, if you are going to do a systematic review, to look at everything that they have created, because it does help a lot. She's also highlighted the importance and the utility of preclinical systematic reviews. And they certainly aren't yet conducted as regularly as clinical systematic reviews. I've done a few talks this year, and 2020 has been described as the year of systematic reviews. However, I think it's important to sort of highlight that these are a research activity that is important in themselves, and they should be conducted to inform lab research, not just something to do perhaps to fill the gaps when our labs are closed due to the pandemic. But for those who have considered embarking on a preclinical systematic review, it can be quite daunting. They are very complex, they're resource intensive and very time consuming. So in my talk, I'll discuss the different ways in which we can address these feasibility concerns, from the type of research question that we look to answer, the employment of some of the automation technologies, and lastly, I'll share with you some of my recent experiences of splitting the work across a crowd of scientists globally as part of the International Association for the Study of Pain Presidential Task Force on Cannabis and Cannabinoid Analgesia. So I don't have any conflicts of interest related to this. I'm funded by the BBSRC, which is the United Kingdom Research Council, and I work closely with the Camarades group, who are the collaborative approach to meta-analysis and review of animal data from experimental studies, and the Epicenter as well, which one focuses more on clinical evidence synthesis. But the work that I'm going to discuss with you is part of the effort of the International Association for the Study of Pain Presidential Task Force on Cannabis and Cannabinoid Analgesia, which is a mouthful to say in one sentence. Most of us will be aware that cannabis is being legalized in countries around the world for both recreational and medical uses. But there's a lot of conflicting evidence for the use of cannabis-based medicines for pain management, and so this task force was established to appraise the evidence. Specifically, they look to assess the basic science and evidence for efficacy in preclinical models, the evidence for efficacy of analgesic efficacy in the clinic, the risk and evidence of harm to an individual, and societal and policy issues. So I use crowd science and machine learning to assist with the preclinical systematic review. But before I begin to speak about crowd science, I think it's important to contextualize some of the challenges that are perhaps more pertinent to a preclinical systematic reviewer. As Meryl stated, systematic reviews are very much vital research tools, and they can provide evidence to inform a variety of decisions, from identifying knowledge gaps to improving methodological quality, as well as the translation of animal trial data to the clinic. The methods of a review are very well established, but we know them to be resource intensive and time consuming. And there are several challenges that are greater perhaps in the preclinical domain. And this may even be exacerbated further given the short time frame and limited resources that we have available to us. So the preclinical field is characterized by very high volume, rapidly occurring data, from studies that have very large variation in how they've been designed, conducted, analyzed, and reported. And this problem is exacerbated further by this exponentially increasing number of publications. In preclinical neuropathic pain research, the number of articles retrieved by systematic search rose from 6,500 in 2012, doubling by 2015 to 12,500. So quite a huge amount of research to go through. Comparatively, though, only 129 articles were identified in a systematic review of neuropathic pain clinical trials. So volume is an issue here. Another issue I think exists is one that systematic reviews are often conducted by a systematic specialist review team, and they try and work more closely with primary researchers. And I think we need to engage and work more closely together. That's primary researchers, librarians, statisticians, software engineers, and developers, so that we can really realize the full potential of preclinical systematic reviews and create this system whereby primary research is informed by a systematic review, and the research that is done is designed, conducted, analysed and reported in such a way that it can be used in meta-research to form an evidence base which we can build upon. So there are several approaches that can be taken to reduce the burden and the risk of exhausting our resources or running out of time. And these are centered around, in the first instance, research design. So the design of the review. The research question should be narrow, clearly defined and answerable. Different reviews can have different aims and will have different resource needs. So for example, a review can be very comprehensive and give an overview of a field, or it can focus on a specific drug or even a specific animal model. But limiting the scope to a specific population or an intervention or a comparator and an outcome measure are ways in which we can still conduct a review, but do one that is perhaps feasible, but gives us some information that is useful to our research. Performing trial searches will assist you to determine the possible workload and really help to hone the research question. Other limitations can be added to a research question, so for example, by publication date. However, we do need to be conscious that this can add a source of bias and therefore must be justified. A meta-analysis isn't always appropriate. A systematic search, screen and annotation can inform a narrative summary and prospective animal studies. So if outcome data aren't required, that can be still a very useful thing to do. If outcome data are required, it may be possible to reduce the data extraction burden by having a specific inclusion criteria for a meta-analysis. So for example, Federico, looking at this pregabalin systematic review, they calculated effect sizes based upon the availability of time course data. Similarly, this can be achieved by including studies perhaps that are just at a low risk of bias, although at the moment the reporting of methodological quality is so low, I'd say it's quite difficult to do that. But as with anything, these sort of decisions do need to be justified and should be stated upfront within a protocol. To consider how we can allocate resources most efficiently, there are a number of platforms now that can help us to do this. So multiple reviewers can be used to expedite the screening, annotation and outcome data extraction stages. And if, for example, you aim to conduct a systematic review for student groups or a research group project, a single research question composed of several sub-questions can be addressed. So students can collaborate during the protocol development, search, screen and data extraction stages, but then thereby contributing to each stage of the project. And at the end, you can take the individual smaller sub-questions and use the data pertinent to that sub-question and perform and report independent analyses that either makes up independent examination submissions or even independent publications. I appreciate the process is far more resource intensive than a traditional narrative or literature review, but the benefits here are far greater. And researchers will really improve their critical analysis skills concurrently to gaining a very in-depth understanding of the evidence within their respective field. And you can use some of the methods of a systematic review to inform a narrative review, whether that is just doing a systematic search and the selection of studies. This will really make a narrative review a lot more robust and potentially reduce some of the biases. So the designer of a review can definitely improve feasibility for an individual research group and assist in addressing a specific research question. But that approach doesn't address gaining an overview of a field, nor our long-standing need as a research community to assimilate the exponentially increasing primary research outputs. So several groups now are working towards taking advantage of emerging technologies to try and modernize the sort of review process. And they're looking to create living systematic reviews. And systematic reviews themselves are not normally or not often updated. And there is concern that not incorporating the most recent data puts them at risk of being out of date and also inaccurate. So living systematic reviews aim to be continually updated, and that new evidence as it becomes available is incorporated. And this ensures that any decisions that are made are dynamic and based upon the full body of evidence. So technological developments are continually being made to reduce the time and human effort required for systematic reviews. And automation tools can be used without making the review living. So for example, machine learning and text mining have improved feasibility and efficiency of the early stages of the review process. Machine learning can be used for study selection and regular expressions for annotation questions, such as reporting of methodological quality criteria can be used too. And tool development continues to ensure that the full potential of systematic reviews, preclinical particularly, can be realised. Technical developments for the latter stages of the review process are still very much in their infancy, but I'm currently working to develop a machine-assisted approach to extracting data from graphs, and we're hoping that will improve the accuracy, but also reduce the time that it takes to do the data extraction part of a review. So given the workload, one of the ways to improve feasibility is either to contribute to a review yourself, or if you're starting your own reviews, to recruit people to assist and spread out the workload. Several reviews have demonstrated it is possible to share this workload across the crowd, and that's whether they are recruited locally or globally. There are always systematic reviewers looking for contributors, so it's definitely worth contacting the authors of a registered systematic review to offer your assistance. You can search the registry on Prospero, or for example, with the Camarades group, they have a registry on their systematic review platform called SURF. It's a very efficient way to gain experience. And I have two examples here, one, both from Camarades group. One, they're currently recruiting a crowd to help them build a systematic and continually updated summary of the COVID-19 evidence. And I can say that is very eye-opening. And a colleague of mine in the EQUIP consortium, Caitlin Hare, she's recruiting volunteers to assist with a review of Alzheimer's disease transgenic animal models and their performance in the open field test. And so reviews really do provide this opportunity to collaborate. It's particularly useful to researchers that have limited experience or limited resources. So more specifically about this project, mine, that we're just coming towards the end now. The IASP Cannabinoid Task Force, I was leading the preclinical systematic review, for which we recruited a crowd of reviewers to assist with two stages, the screening and data extraction phases. The main aim of our review is to estimate the antinociceptive efficacy of cannabinoids, cannabis-based medicines, and endocannabinoid system modulators in animal models of pathological or injury-related persistent pain, whilst also taking into consideration the risk of bias and any publication bias. So we published the protocol in pain reports, and it describes our methods in detail. After the protocol was developed, we performed a search of 3 electronic databases and identified over 10,000 articles for screening. And our recent experience suggested that we were likely to select for inclusion approximately 10%, so around 1,000 studies would require data extraction, which is a huge amount of manual work to do. We had very tight timelines, wanting to complete this work as quickly as possible. So a growing amount of research now is being conducted in an open and collaborative fashion. So we really did see that to be a potential solution, whatever we want to call it: crowd science, citizen science, network science, distributed collaboration. Crowd science aims to draw on the effort and knowledge inputs provided by a large and diverse base of contributors. We can expand perhaps the range of problems that we can solve at relatively low cost, and hopefully at the same time increasing the speed at which these tasks can be conducted. Using a crowd challenges perhaps some of the traditional approaches of systematic reviews, and then being conducted by expert teams, and offers an opportunity to hopefully try to improve the efficiency and accuracy, and it allows us to engage a wider community. So like I said, there's 2 ways in which in this project that the crowd contributed, but more generally speaking, a crowd can either contribute by conducting a specific task or providing examples that can be used to train machines, so that task can then be automated or semi-automated. And the crowd aims to offer a less labour-intensive model, which will allow the authorship team to make more efficient use of their skill sets and allocate their time to the more specialist tasks. So a crowd can be utilised to conduct the tasks that require the more common human skills, through to specialised skills and expert skills as well, but we have to then recruit accordingly. So there's 2 stages in my review that required the crowd. The first was screening studies for inclusion and exclusion by reading title and abstract, and the second was extracting the data required from the included studies. And those data comprised of reporting how experimental bias was mitigated, the animal models, the treatment regime, outcome assessments, and finally outcome data. And many of the studies tested multiple drugs, different doses, routes of administration in multiple models, and then assessed the effects in several behavioural assessments. So many of the studies were very complex and required a lot of data to be extracted. And these activities were conducted on the platform SURF, which is the Cameradi Systematic Review and Meta-Analysis Facility, and it's a free, fully integrated online platform for conducting preclinical systematic reviews. So my aim was that crowd members would gain professional development opportunities, so they would gain a more in-depth understanding of systematic review process and refine their critical analysis skills. And they would also be able to make a meaningful contribution to a large review, part of an international collaboration, which I think to be quite enticing. And in return, I hope that the crowd would increase the rate of the review, getting it done quicker, of course, improve the accuracy and reduce the individual input by sharing the workload across a large number of people. I think an important feature of crowd science is that participation in a project should be open to a large number of potential contributors, and anyone who's interested and qualified can be invited to join. That will often be in a self-selecting manner. A challenge, however, is attracting contributors and coordinating the contributions of all of these participants. So recruitment was the first challenge. Our recruitment strategy aimed to target bioscientists that were interested in contributing to an important area of research, but we didn't have any prerequisite criteria. So our participants, while all bioscientists, still had a very varied knowledge of the topic, and most didn't have experience of systematic review processes. We did anything that we could to raise awareness and encourage people to sign up. But beyond professional development, we also did offer other incentives, including authorship. I think when doing something like this, it is important to consider what incentives are appropriate and how they can be awarded fairly. Also wanting people to appreciate that we did know that they were volunteers and they weren't obliged to contribute, so the project shouldn't do them any harm. So once someone had enrolled, they were then invited to conduct some training. The training modules were hosted on an online platform called Learn to Surf, and I supported this with a manual and comprehensive instructions and guidance notes. And to contribute to the project, participants had to pass these training modules. If they had failed or didn't complete the training, they weren't able to participate. It's important to note though that training alone cannot ensure quality, particularly if a crowd has varied levels of experience. They can still pass training having not fully grasped some of the concepts, or they may go on to make mistakes or not realise perhaps, or even feel too embarrassed to raise any questions that they have. What I think often happened for us was that reviewers were faced with more complex examples than they had experienced in the training. So I would advise to have a system for conducting quality control throughout the project, so you can identify any issues as they arise, share those lessons learned with everyone, and ensure that they are addressed during the project as opposed to a problem being carried on throughout. As with any large collaborative project, communication and accessibility is key. Ensuring best as possible that language is understandable, but I also needed to be flexible to work across time zones, recognizing that not everyone has had the same knowledge, experience, and are giving up their free time. And the infrastructure is key to this. Surf, in our case, was quite easy to use, but any technical problems we also needed to be on hand to address. I used MailChimp to send out regular newsletters to keep everyone informed of the progress, share our lessons learned, and also provide further training contextualizing the elements of the review. So for example, why risk of bias was so important, what are the animal models for pain research, and included a reading corner for reference material. So crowd members were welcome to email me at any time, and I had this unwritten rule that I'd respond within 24 hours. Working across time zones and balancing other commitments is challenging, but when you have a volunteer force, you want to be able to make sure that we can make the best of their time. So who are the crowd? We had 453 people sign up from 44 countries. The majority of the crowd members were from the States and Northern Europe, which is probably a reflection of our own network. But we did have some reach, and we have representation from middle and lower income countries too. And the majority of crowd members were early career researchers. Of the 450 people that signed up, 100 made a meaningful contribution. Training clearly was a big hurdle, with 50% not actually completing training. But once people had passed the training, they remained very committed to the project. This really demonstrates the need to recruit many more to account for attrition, but also to consider the task in hand. Is it actually something that most people can do? 28 met the authorship criteria, which is a huge effort on their part and a contribution for which, of course, I'm very grateful. The crowd definitely reduced the individual input requirement, but it's a lot more difficult to answer whether the crowd saved the time and improved accuracy. I think in my project, the crowd perhaps didn't save time, and they are volunteers. So whatever their motivation, people have other commitments, and it's likely that people will commit to doing the minimum to reach a target that they set for themselves over a time frame that is plausible for them. In addition, though, saving time can be a bit of a fallacy if the quality or accuracy of the work is not standard. And accuracy, of course, can then be affected also by the experience of the crowd. However, despite my original aspirations and motivations to reduce time and increase accuracy and those not being met, there are several perhaps intangible or more difficult to quantify benefits of doing a project using a crowd. And much of these really do echo what Meryl had shown us from their findings of the impact study, which I found really interesting to hear, and I feel slightly vindicated that this is a good way forward. So community engagement, training and education, certainly the sharing of the workload. And for us as well, because I'm interested in developing tools, it gives us feedback for tool development and future projects for you for crowd science. And just to add some more weight to the broader benefits argument, these data, which I think are very similar to what Meryl presented, these are based on feedback survey from some of the crowd members. And members felt that their critical analysis skills had improved, they'd enhanced their professional skill set, it's led to the improvement of their own research practices, including an improved understanding of animal study design, conduct and reporting. And they've also got a greater understanding of the rationale and how to conduct a preclinical systematic review. And for anyone that's never done a preclinical systematic review, I really do recommend giving it a go, because you will see how complex they are, how little information that you would expect to be there isn't there. So it's certainly a good way of honing those skills. So to summarize my experience with a crowd, I think before you embark on a systematic review, whether that's with a crowd or not, it does require a cost-benefit analysis. There's always going to be a question of resources. If you're going to use a crowd, who is going to manage the crowd? What are the research aims and timelines? Have you got the tech or the infrastructure to support and coordinate a large group of people? Does the task require a common or more specialist skill set? What training can you provide to ensure quality, and can you control for quality throughout the project? Can you trade off accuracy for the broader and larger inclusion, knowing that you'll need to control maybe for this in another way later in the project? So I had very ambitious timelines for my project, and so for that reason, if just looking at my project, I could question the use of a crowd versus allocating specialist resources and building a bigger specialist research team. But that's a very short-term project-focused view. And I think what was really amazing is be able to speak and do science with people from all across the world. I feel better plugged into the community of pain researchers. And I think there are many difficult to quantify benefits, but I don't see there to be anything better than making a project open, transparent, and inclusive. And so I hope that we see more projects like this being funded, and that we have future opportunities that are similar. So thank you for taking the time to listen, and I look forward to our Q&A now.
Nadia and Morel, thank you both so very much for really, really insightful